Hi there, I'm Dr. Matthew Schulman, board certified plastic surgeon, and today I'm going to talk to you about two procedures that are commonly confused: breast implants and breast lifts. So this video should help tell you what the difference is between these two procedures. And I see patients all day, every day, and I can tell you that they're really confused by the difference. People think a breast implant will lift and a lift will make you bigger and all sorts of stuff. So watch this video, and I think it's going to clear things up about these two procedures. So we're talking about a breast implant, which basically uses a silicone gel or a saline implant to make your breast bigger. And then we're talking about a breast lift, which is going to do what you think it's going to do. It's going to lift the breast. So how are they different? Well, an implant or breast augmentation is going to make the breast bigger. So it takes the breast you have and just adds volume. So it pumps things up and makes it look fuller and larger and rounder. And yes, there might be the slight appearance of a lift, but technically it's not lifting, it's just inflating. If you think about having a balloon and you add some air to the balloon gets rounder. That's what's happening to your breast. So it's very, very common for it to look more lifted, but it's really not. A breast lift, on the other hand, is specifically designed to lift the breast. It's not going to make it bigger. In fact, sometimes when you get a breast lift, it almost gives the appearance that the breast gets a little smaller because now the breast is up and lifted and tighter and perkier, so it might look a little bit smaller, but we're really not doing anything to the volume. We're just lifting. So the big question is, which do I need? Do I need a breast implant or do I need a lift? And you really have to take a step back and think about what your issue is. Do you want your breast larger? Then you need an implant or breast augmentation. Or do you feel like your breasts are droopy and your nipples are pointing down? Then you need a breast lift. So again, an implant or an augmentation makes you bigger. A lift lifts. Now, to make things a little bit trickier and a little bit more complicated, sometimes we actually combine the two procedures. So if you're someone that says, I need my breasts lifted, but I also want them bigger, then we can do a lift and put an implant in. So we can get you up and we can get you bigger. That's a combined lift plus an implant. Because these two procedures are different, the incisions and the scars are different as well. When I do a breast implant, I just have to get this implant into the breast, and that can be done with very small incisions that are either hidden underneath in the breast fold, around the areola, or sometimes in the armpit. Those scars are small and well hidden. A breast lift, on the other hand, requires more scars because the whole point of a breast lift is to lift the breast, and that's done by removing excess skin and repositioning and reshaping the breast tissue underneath. So I can't do that through a little tiny incision. I need to make larger incisions. So the scars associated with a breast lift can vary depending on how much of a lift you need. If you just need a little bit of a lift, then it might be possible to make an incision and a scar just around the areola, like a circle. And that's going to help bring the nipple and the areola up. If you need a little bit more of a lift, then I have to remove skin in an up and down direction. So what you'll end up with is what we call a lollipop scar, which goes around the areola and down the front, like a lollipop. For most people, they have a significant amount of excess skin and they need a significant amount of lifting. So we have to add a little bit more of a scar. So they would have the scar that goes around the areola, down the front, and underneath. That's called an anchor incision. So I get that the scars associated with a breast lift are more than the scars associated with an implant. But that doesn't mean if you need a lift, you can choose to have an implant in order to avoid the scars, because they're totally different operations. As I keep saying, a lift lifts and an implant makes bigger. So let's just say that your breasts are droopy and you need a lift, but you don't want the scars. You think that you can just put in a big implant, which is going to fill you up and make it look like you have a lift, and you can do it with just a tiny little hidden scar. That doesn't work, and I actually think that's a very dangerous thing to do, because all that's going to do is make your droopy breast bigger and heavier and more droopy. it's not going to make it lifted and perky like you probably want. So my advice to you is if you need a breast lift, but you don't want to have the scars associated with the lift, then don't do anything. The worst thing you can do is do the wrong operation. So if you need a lift, but you don't want it, don't get big implants to try to avoid getting a lift. So I hope this clears things up, because this whole idea of a breast implant versus a breast lift can be really confusing to people, and they just kind of think the operations are just interchangeable. They're not, they're very different. So if you take anything away from this video, you should know that a breast implant makes you bigger. A breast lift lifts. And sometimes we combine the two so you can get bigger and lifted. So if you like this video, make sure to like, comment, and share. Check out the other videos that we have on my YouTube channel, because I answer a lot of questions and clarify a lot of things that might be confusing to you about plastic and cosmetic surgery. Again, I'm Dr. Matthew Schulman, board certified plastic surgeon from New York City, and this is my YouTube channel.